We already talked about the obesity epidemic. Well, we're also in the midst of an epidemic in diabetes. This is because obesity and diabetes are closely linked together. We understand that obesity is a causal factor in many diseases, and diabetes is probably on the top of the list. What is diabetes? Diabetes is a disease characterized by elevated blood glucose levels. Statistics tells us that currently 1 in 10 of adults, or 29 million people in the US, has diabetes. This number is projected to grow to 1 in 3 adults by the year 2050. This figure shows in the yellow line the percentage of people in the United States who have been diagnosed with diabetes from 1960 onwards. The actual number of people with diabetes is shown in orange. You can see that diabetes has been steadily rising, but in the last 10 years, the rate has really increased. This clearly shows why we're worried about this epidemic. Diabetes is a major public health problem in the United States. This slide shows trends from 1994 to 2010 in obesity in the top panel, and the trend in diabetes in the bottom panel, according to the states in the US. As the color goes from yellow to red, the percentage of the population with obesity and diabetes is increasing. Over the last 15 years, we can see the reddening in several states showing the parallel rise of obesity and diabetes. Remember that obesity and diabetes are closely linked. This epidemiological evidence clearly shows this link. Before we go further, let's go over some terms used in the field of diabetes. Glucose in the blood is the main source of energy for many cells in the body. Blood sugar is often used in lay language to mean blood glucose. The brain primarily uses glucose. However, during starvation, a form of blood lipids can also be used. But this is not the ideal state. Muscle also uses glucose as well as lipids in order to function, but glucose is the most easily accessible source of energy. The glucose cannot get into muscle cells on its own. It needs the hormone insulin to stimulate the entry of glucose into muscle cells. Insulin is made by cells in the pancreas called beta cells. The cells are stimulated to make insulin after food is ingested. So after a meal, our insulin levels increase, and the muscles are able to take up the glucose in the blood and use it for energy. If there's a problem with glucose uptake into muscle, the muscle cells are deprived of energy and they do not function well. Also, since glucose remains in the blood becomes syrupy. The blood flow around the body becomes more sluggish, like a clogged pipe. This especially affects the blood flowing in small capillaries, such as in the eyes and nerves. This phenomenon of syrupy blood and reduced flow to tissues is part of why we see the complications that result from diabetes. Glucose tolerance is a normal physiological condition where everything is working properly. A person eats a meal, their blood glucose rises, and then insulin is made and glucose travels into the muscle and other tissues. However, if not enough insulin is made or if it does not stimulate glucose uptake into muscle, this causes glucose to remain in the blood. This condition is called glucose intolerance. A person consuming carbohydrates does not clear the glucose from their blood, and their blood glucose remains elevated. A glucose tolerance test is used to determine a person's tolerance to a carbohydrate-containing meal. The person needs to be fasted overnight before the test. Physicians give the person a drink loaded with glucose, about the amount in 2 cans of Coke. The drink should be consumed in 5 minutes. Glucose is measured before the drink and at 2 hours after the drink. If the glucose readings are elevated, the person is characterized as glucose intolerant. Diabetes can be diagnosed by the glucose reading at fasting before the glucose tolerance test or at 2 hours following the test. Normal levels are under 100 milligrams per deciliter at fasting condition or under 140 milligrams per deciliter after the 2 hours. Between 100 and 125 at fasting and between 140 and 200 at 2 hours is called prediabetes. Greater values than 126 at fasting or than 200 after the 2 hours is diagnosed as diabetes. More terms to know are type 1 and type 2 diabetes. People who have type 1 diabetes are dependent on insulin, and this type of diabetes is usually diagnosed in young people. People who have type 2 diabetes may or may not be dependent on insulin, and this type of diabetes usually affects adults. There are other types of diabetes, including prediabetes, gestational diabetes, and undiagnosed diabetes. 5 to 10% of the people who have diabetes have type 1 diabetes. It is an autoimmune disease caused by the person's own antibodies attacking and destroying the beta cells that make insulin. This results in the person being deficient in insulin. In most people who have type 1, the disease occurs in youth, ages 6 to 10. The child suddenly suffers symptoms associated with high blood glucose, like frequent urination, unexplained weight loss, lack of energy, and excessive thirst. And when they get checked out at the doctors, the diagnosis turns out to be diabetes. This disease is treated by insulin injections. Controlling carbohydrate intake and exercising also helps control the blood glucose levels. The cause of type 1 diabetes is not yet known, but genetics and viral infections are thought to be possible factors. Most people who have diabetes have type 2 diabetes. Initially in the disease, insulin is produced just fine, but the problem is that it's not working. The muscle is not stimulated to take up blood glucose. So the problem is different from that in type 1 diabetes where insulin is not produced. The phenomenon of insulin not working properly is called insulin resistance. We are starting to understand why some people develop insulin resistance and how obesity is involved. Excess adipose tissue produces chemicals that impair the function of proteins that are stimulated by insulin. Since obesity is one of the main factors that causes insulin resistance, the treatment of insulin resistance is diet and exercise to induce weight loss. Since insulin doesn't work, the beta cells produce more and more insulin, and as long as this occurs, the person can maintain glucose tolerance. Eventually, the beta cells become exhausted and can no longer produce insulin at high levels. At this point, the person becomes relatively deficient in insulin, much like a person with type 1 diabetes. Then the treatment is not only to improve insulin resistance by diet, exercise, and some medications, but also to take insulin injections. Let's review again the pathophysiology of type 1 and type 2 and notice the differences between the two diseases. For type 1 diabetes, insulin is no longer made and the person is deficient in insulin, and then they show symptoms of diabetes. In type 2 diabetes, the person is initially insulin resistant and can maintain glucose tolerance by making more and more insulin. However, eventually the cells can no longer continue the high production of insulin that's needed, and then they become insulin intolerant. Gestational diabetes is a type of diabetes that's diagnosed during pregnancy. This is because pregnancy is actually a state of insulin resistance. Some insulin resistance is good for the developing fetus so that it has access to the glucose in the mother's body. However, the mother must be able to produce extra insulin to cope with the extra glucose in the blood. If the mother also becomes insulin deficient, then the mother and the fetus are exposed to high levels of glucose. This causes complications to the pregnancy that can be detrimental. It is important to treat gestational diabetes through diet, exercise, and medication. After the pregnancy, the diabetes often goes away, but in 5 to 10 years, the diabetes can return. So gestational diabetes is considered to indicate future risk of type 2 diabetes. Other types of diabetes are undiagnosed diabetes and prediabetes. We are seeing epidemics in these types of diabetes as well. Many people have diabetes and don't know it. They don't recognize the symptoms, or they live with the symptoms without going to the doctor. Symptoms of diabetes include frequent urination, excessive thirst, extreme hunger, and unexplained weight loss. Without treatment for diabetes, the people are likely to suffer complications from the disease. The state of prediabetes is an early sign of diabetes that often leads to diabetes. However, fortunately, prediabetes is an early warning stage that, if treated, can revert back to normal glucose tolerance stages. is therefore important to identify and treat people with prediabetes. If blood glucose is not in control and stays high, people develop diabetes complications. Diabetes is thought to be a silent killer because some of these complications are not obvious when they're occurring until it's too late. The complications can be explained by the syrupy blood, which leads to a slow rate of blood flow through the tissues. For the nerves, the eyes, and the kidney, which have small capillaries, the tissues die because they're starved of energy. Other tissues become brittle and the blood flow can become clogged. So we see health problems like high blood pressure, heart disease, stroke, blindness, kidney disease, and amputations. There are other health issues related to diabetes that have been identified but are not well understood, including fatty liver disease, cancer, and depression. Gestational diabetes not only involves complications in the mother, but also the fetus. For the mother, high blood glucose can promote hypertension, and because the fetus grows faster than normal, delivery can be difficult. Also, as stated earlier, the mother is at future risk for having diabetes. For the fetus, if the head or shoulders are large, this can lead to injury during birth. Also, a baby that is large at birth can continue to be overweight and obese during childhood. Also, there's information that exposure to high glucose levels while in the womb can lead to future metabolic problems like diabetes and cardiovascular disease in adulthood. The risk factors of diabetes are still under investigation. This slide shows what we know so far. Some factors such as our race or ethnic origin, age, and genetics are not modifiable, meaning they cannot be changed. Certain groups are more at risk for diabetes, but we're not sure why that is. Also, there are some genes that change how well insulin works or how well it can be produced. As people age, insulin production and function decline, so aging is a risk factor for diabetes as well. The good news about risk factors is that some can be changed. If we lose weight, especially through diet and exercise, we can reduce our risk for developing diabetes. The main goals for prevention and treatment of diabetes is to maintain or achieve glucose control. This has been shown to be possible for people with prediabetes and diabetes. The first line of prevention and treatment is lifestyle modification. This involves weight loss through diet or exercise. Some recommendations are for reducing caloric intake to under 1,500 calories per day and increasing physical activity to 30 minutes per day, 5 days a week. There's a lot of debate about exactly which type of diet or exercise is effective, but low carbs, low fat, high protein, resistance training, aerobic training have all been shown to work. The second line of action is medication, and there are various medications that improve insulin resistance and insulin secretion. Sometimes one type of medication works better than others, depending on the individual. The last line of therapy may include bariatric surgery for patients who are severely obese, as bariatric surgery has been shown to ameliorate type 2 diabetes in many patients. The Diabetes Prevention Program was a large clinical trial in the United States that showed that diabetes can be prevented or treated by weight loss through diet and exercise. People who entered the study were overweight and had prediabetes. Some were randomized to having 30 minutes of activity per day and reducing caloric intake. The study results showed that patients who had achieved weight loss of 5 to 10% prevented or delayed the onset of type 2 diabetes. This slide shows the results of the Diabetes Prevention Program. Shown in the green line is the development of type 2 diabetes in people who were not treated by lifestyle modification or medication. They were just on placebo treatment. As the years progressed, more and more people developed diabetes. The yellow line is the development of type 2 diabetes in people who were given medication to prevent diabetes. The blue line, however, which is the lowest line, shows that fewer people develop type 2 diabetes through lifestyle modification. We need to know more about how to prevent and treat diabetes. For prevention, perhaps knowing more about the early signs would be helpful. Research here looks at the signatures of very early diabetes, such as using genetics or protein signatures or metabolites, measuring people's blood samples. Other information that we need to know is why obesity leads to diabetes in some people, and if there are some dietary or physical activity factors that by themselves can promote or prevent diabetes.